The Clean Clinic approach, or CCA, aims to facilitate incremental wash improvements in healthcare facilities to improve cleanliness and improve the quality of care. Developed by USAID's Maternal and Child Survival Program, MCSP, and by Save the Children, the Clean Clinic approach works with national ministries of health to develop minimum wash standards that individual healthcare facilities can strive towards, with an ultimate goal of achieving Clean Clinic status. Because the approach recognizes that ideal wash conditions at a health facility require increases in funding, staff, and infrastructure, it operates on the premise that smaller incremental improvements can have significant impact. These improvements take different forms, including improving the waste management and disposal system, ensuring hand washing stations with soap are available and conveniently placed, assigning staff simple roles like restocking hygiene supplies and soap, or setting up easy to implement infection prevention and control protocols. 5 overarching goals drive the Clean Clinic approach. The first goal is to develop self-sufficient healthcare facilities that are clean, desirable, and well attended. Second, though countries have varying administrative structures involved in water and sanitation, the Clean Clinic approach aims to ensure that wash in healthcare facilities is a cornerstone of providing quality healthcare. Because quality healthcare resides in ministries of health, the Clean Clinic approach works to embed ownership and accountability of health facility improvements within the Ministry of Health. The third goal is to empower staff, starting with management, and communities to routinely improve and maintain wash conditions and practices at their healthcare facility. Moreover, it aims to break down the expectation that improvements can only come when external funding is brought in. The fourth goal is to develop realistic goals for wash at each targeted health facility. Because ideal conditions can rarely be met without external assistance, incremental changes that make a difference are prioritized. Because health facilities are a center of communities, especially in times of need, the final goal of the Clean Clinic approach is to support these facilities to better prepare for and manage future outbreaks and emergencies. The Clean Clinic approach operates and deploys a number of principles and tactics listed here. A focus on doable actions, ensuring government ownership of the process and results, integration with existing planning processes. That is, the CCA does not create new systems or processes. Using competition between facilities and social recognition to generate motivation among facility staff. Building leadership within the subnational, like district or community health teams, as well as each facility. Using supervision, inspections, and coaching to assess progress. And improving emergency response and planning and capacity. The Clean Clinic approach deploys the following step-by-step model, but maintains flexibility to adapt to local contexts, politics, and environments. The approach readily incorporates into existing policies and standards and fills gaps where they exist. Step 1 is to conduct a rapid assessment of participating facilities to determine the state of cleanliness and wash within healthcare facilities. Results of this assessment then inform conversations with the Ministry of Health, facility staff, and other relevant stakeholders. In partnership with the Ministry of Health and other relevant stakeholders, Step 2 establishes and refines national minimum wash standards. At this stage, specific indicators are outlined for various components of a wash and healthcare facility improvement program, such as water treatment, cleaning routines, hand washing protocols, and many others. Another important aspect of this stage is to establish a cleanliness certification ladder, one that each healthcare facility can strive to attain. To explain this concept further, we'll look at how MCSP, in partnership with the Haitian Ministry of Health, developed a cleanliness certification ladder for Haitian healthcare facilities. In Haiti, various levels of cleanliness and wash standing were defined: guaranteed, gold, silver, diamond. A Washington Healthcare Facility scorecard was developed to measure facilities' progress against these levels. During inspection visits, each facility is graded against this checklist and receives an overall score. Once all inspections are completed, scores are published to all participating facilities. When publishing scores, it's common to hear staff members discuss their own scores in relation to the scores of other facilities. Thus, the cleanliness certification ladder fosters motivation among staff and management by leveraging the power of social recognition and competition. Once cleanliness standards are defined, Step 3 of the Clean Clinic approach process develops program parameters alongside the government. It is vitally important to have government ownership and engagement at every stage. Step 4. Upon agreement on standards and program parameters, Step 4 of the Clean Clinic approach calls for the training of district and healthcare facility leaders. During this training, district and healthcare facility leaders are provided refresher information on WASH at the healthcare facility, trained on established standards, introduced to the Clean Clinic methodology, and empowered with the responsibility to make WASH changes in their locales. These trainings also establish roles and responsibilities for the district staff and healthcare facility managers during program implementation. Step 5 introduces the Clean Clinic approach to individual healthcare facilities, which involves a similar training and discussion with healthcare facility staff. Once Step 5 is complete, in all facilities in a target geographic area, the Clean Clinic approach is officially launched. It's important to note that Steps 1 through 5 of the Clean Clinic approach are only conducted at the beginning of implementation. Subsequently, Steps 6 through 10 involve a cyclical process through which individual facilities identify and work towards incremental WASH improvements. With the national standards, program parameters, and rapid assessment results in hand, Step 6 requires individual healthcare facilities to identify WASH improvement needs in their facility. Once all the WASH improvement needs are compiled, the healthcare facility managers prioritize needs and develop an annual action plan to begin addressing those needs. These action plans may include simple management system changes or infrastructure improvements that the healthcare facility can complete on its own. The action plan may also include larger priorities and plans to seek external support from the Ministry of Health or other external stakeholders. Step 7 is where healthcare facilities get to take action on their plans. Well-intentioned facilities work on prioritized needs, self-monitor progress, validate low-level workers such as cleaners and guardians, spread the word in the community about the WASH improvements at the facility, and build a culture of accountability among staff for every task, no matter how menial. Once the facility achieves its goals, staff and leadership repeat the planning process. During Step 8, inspector visits deploy the checklist scorecard to score each facility's progress. Once inspections are complete and the scores are published, coaching visits help facility staff maintain motivation, address shortcomings, and continue progress. The publishing of results is a critical component of the Clean Clinic approach, as it nurtures competition among facilities, local administrative units, and regions. Publication of results also allows communities to see the effort or lack of effort their facility puts towards improving WASH in healthcare facilities. In principle, it gives the public an opportunity to select which facility they may prefer based on cleanliness and quality of care measures. In other words, it helps communities seek accountability from the healthcare facility they frequent. Step 9. In conjunction of the publication of results, governments can design a recognition plan to reward achievement of top-performing facilities. Recognition may come in many forms, including annual certificates, radio or social media announcements, celebration events, or monetary awards. Step 10. After the last inspection of the year, each healthcare facility reviews the past year's action plan and revises it to make further improvements in the coming year. The cyclical process of the Clean Clinic approach aims to empower staff at each healthcare facility to make small, incremental improvements with available resources. The incremental improvement process outlined in steps 6 through 10 repeats on an annual basis. Capital incentive improvements are possible, but the process is the same. Identify the problem, prioritize steps to achieve it, and then monitor your progress. To download the Clean Clinic Approach overview, please click on the Clean Clinic Approach brief icon on the web page. To learn more about MCSP's experience implementing the Clean Clinic Approach, please scroll down to Country Highlight sections on the main web page.